In this hematology lesson, what are the main types of leukemia and how do we distinguish them? Acute and chronic leukemias. One of the easiest ways to understand leukemia is to classify it into two groups. The first classification is acute versus chronic. Acute leukemia involves immature cells called blasts. These cells multiply rapidly, causing disease that develops quickly. Acute leukemias are generally more common in younger patients. Chronic leukemia involves more mature cells. These cells accumulate slowly, so the disease progresses more gradually and is more common in older adults. The second classification is myeloid versus lymphoid. Myeloid cells give rise to granulocytes, monocytes, red blood cells, and platelets. Lymphoid cells give rise to B cells, T cells, and natural killer cells. Combining these classifications gives us four major types of leukemia: acute myeloid leukemia, or AML, acute lymphoblastic leukemia, or ALL, chronic myeloid leukemia, or CML, and chronic lymphocytic leukemia, or CLL. Let's start with acute myeloid leukemia. Think of three words: adult, myeloid, Auer rods. Acute myeloid leukemia is the most common acute leukemia in adults. Patients usually present with fatigue from anemia, infections due to neutropenia, and bleeding because of thrombocytopenia. The classic laboratory finding is the presence of Auer rods inside myeloblasts. An important subtype is acute promyelocytic leukemia. It is associated with a translocation between chromosomes 15 and 17, producing the PLAB fusion gene. The major complication is disseminated intravascular coagulation, and the treatment is all trans-retinoic acid. A simple memory aid is APL, ATRA, PMLRARA, and DIC. Next is acute lymphoblastic leukemia. Think of little children. Acute lymphoblastic leukemia is the most common leukemia in children. Patients commonly present with fever, fatigue, bone pain, infections, bruising, and bleeding. It may spread to the central nervous system and the testes. The important laboratory marker is TDT positivity. Remember, ALL means acute leukemia in little children. Now let's move to chronic myeloid leukemia. The key feature here is the Philadelphia chromosome. It results from a translocation between chromosomes 9 and 22, creating the BCR-ABL fusion gene. This produces an abnormal tyrosine kinase that causes uncontrolled cell division. Patients often have a very high white blood cell count, splenomegaly, fatigue, and weight loss. Treatment is with tyrosine kinase inhibitors such as Imatinib. A useful memory aid is CML, Philadelphia chromosome, BCR-ABL, and Imatinib. Finally, let's discuss chronic lymphocytic leukemia. This is a chronic cancer of mature B lymphocytes and is common in elderly patients. Many patients are diagnosed incidentally during routine blood tests. Symptoms may include enlarged lymph nodes, recurrent infections, and splenomegaly. The classic laboratory finding is smudge cells. Remember, crushed lymphocytes leave smudge cells. Let's quickly compare all four leukemias. AML affects adults, involves myeloid blasts, and is associated with Auer rods. ALL affects children, involves lymphoblasts, and is associated with TDT positivity. CML is associated with the Philadelphia chromosome, the BCR-ABL fusion gene, and treatment with Imatinib. CLL affects elderly patients, involves mature B lymphocytes, and is characterized by smudge cells. To summarize, remember these one-line examination facts. AML equals Auer rods, adults, and myeloid blasts. ALL equals children, lymphoblasts, and TDT. CML equals Philadelphia chromosome, BCR-ABL, and Imatinib. CLL equals elderly patients, mature lymphocytes, and smudge cells. If you can remember these four patterns, you'll be able to answer most undergraduate hematology examination questions with confidence. If you're a medical student, nursing student, or any healthcare student who enjoys learning by practicing questions, be sure to check out StudyWorkspace.online. It lets you turn your own notes, lecture transcripts, past papers, PDF documents, and other study materials into interactive multiple-choice questions in just a few clicks. You can organize your question sets into folders and subfolders, making it easy to keep everything structured and revisit topics whenever you need. It's a simple way to test your understanding, identify weak areas, and make your revision more active. Visit StudyWorkspace.online and start studying smarter today.